Bienvenidos de nuevo a otro episodio del podcast Resting Stitch Face. Yo soy la doctora Sarah Harding y estoy aquí.
Doctora Erin Sheffield.
Hola, Erin.
Hola, amiga. We are just getting back from our, we can call it girls' trip to Mexico City.
Mm-hmm.
Got in at like 1 a.m. on Sunday morning. I know you got home probably about the same time on Saturday, right?
Yeah, about 2 a.m. on Saturday morning. And just in
So
time for some baseball games at 8:30 and 9:30.
that's the life of a mom, right?
That's
Just
right.
right back at it.
Yes.
Right back at it for sure. Well, I would say I thought it was a fantastic trip, so much better than I expected. I guess I had a lot of question marks about what it would be like and how safe it was gonna be, etcetera. What did you think? Did it go how you expected?
No, I had 0 expectations. I just was along for the ride, and it was just, I don't know, I think that I was excited to go, but I didn't really understand how it was all gonna work. I knew that it was gonna be different from what we're used to, but I didn't know how it was gonna work and how it was gonna go, so I think I didn't have any expectations because I just figured, well, we'll just figure it out as we go, and we did.
Yeah, for sure. For sure. Well, we went to the basically Mexican Oral Surgery Association Congress Seminario because they invited me to come and give about 5 hours of lectures. So
A
that
straight up
was
marathon.
why we were there in Mexico City. And I thought it was really fun just to see what a professional conference was like. In some ways, it was very similar to, our association meeting and what that's like. But in a lot of ways, it was so different. So, what was the most surprising difference to you?
To me, I think the biggest surprise was everyone there seemed to genuinely be happy to be there, and it seemed more of a reunion than a professional conference, I
Yeah.
think. What do you think?
Yeah, that makes sense. It felt friendlier. The vibe felt friendlier. I feel like in the US, a lot of these conferences feel kind of like an ego thing or like a pissing contest a little bit. I don't really like that phrase, but I feel like everyone's trying to like prove that they belong there or to like figure out
Right.
where they are in the hierarchy, etc. And it felt a lot friendlier to me.
Yeah, same, and maybe it was because we didn't neither of us really speak Spanish
I was
very
gonna say,
well.
maybe it's because we had no idea what was going on.
Yeah, they could have been like, "You dumb Americans," and we'd be like, "Ah, la, la, la," but I didn't
I
feel that
also will
way.
say, it was interesting. We attended quite a few of the lectures despite the fact that they were many or most of them in Spanish. And I would say I enjoyed some of the Spanish lectures more than
It's
the
true.
typical English ones. Maybe it's because I had to be a little bit more engaged to understand what was going on. Like I know just enough Spanish that I could read the slides and with
Mhm.
the context kind of have an idea of what was happening. And I don't know, as I enjoyed it much more than I would have
Yeah.
thought for not really being fluent in the language.
Yeah. And I was really impressed by it seems that there's a big push there now to move more into the microvascular space. There was a ton of lectures regarding that, nerve
Mhm.
repair and facial reanimation and things I didn't expect necessarily. But it seemed like that was the big theme almost. And then our
Yeah.
guide was our beautiful, wonderful hostess, Claudia. She has been doing observerships. I mean, she was in uh, Michigan, and she's been in somewhere in Florida and then somewhere in Texas, and really trying to get a hold on what's going on with it so that she can bring more of that to Mexico, which I just think is incredible.
Yeah, super cool. Super cool.
Uh,
I think the biggest surprise to me was the social event that we went to.
Yes.
So, during my lecture or, like, around my lecture, you know how they have, like, the flashing signage, for, like, what's coming up, and they kept having this picture of this boxer, Juan Chorritos Hernandez, and they're like,
Chorritos.
yeah, at 7 PM, ahora, 7 PM. And so we are like, "What is that?" And they're like, "Yeah, it's boxing." And I 100% thought it was gonna be like a pay-per-view thing. 'Cause they're like, "He's the world champion
Yeah.
boxer." And so they're like, "Are you guys gonna come?" So we headed down and we walked in a room and it's got this giant boxing ring set up in like a conference room. And it was real live boxing and that was incredible, I will say. Much more fun than a lot of the things we were doing at our own
Oh my
events.
gosh, it was just so much fun. I couldn't believe it. I couldn't believe how engaged I was the whole time. I was like, "What's gonna happen next?" You know? And they
I don't
were
think of myself as a boxing fan either, but it's
right.
just really fun to see.
Yeah. But the energy in that room was so cool, right? It was
Yeah,
I
they're
don't know
just
if
passing
that's
out beer and sandwiches,
yeah, they
and
just kept
then
running around with it, rolling around with these sandwiches. You know, every 10 minutes they'd come back and try and offer you some more sandwiches, and that was so funny. But everybody was so engaged. It was so fun. So,
well, and then was it that same night? They're like, "Oh, you guys haven't eaten dinner? You guys missed the dinner?" And we're like, "We didn't know there was a dinner." That's the problem with not speaking Espanol. And so they're like, "Okay, let's go out." And so the next thing you know, like, this big group of us is walking to some cantina, and we sit down, and they just start ordering all of this food,
yeah,
and
and
it's just
it started as just a couple of us, right? There was just gonna be a couple of us
yeah.
going, like 4 or 5 of us going, and then the group just grew, and then we got there, and then a whole other group came in and joined us, so we moved over to the next table so that we could have this, big, long table with all these people.
Well, then I was, like, looking at my order, and next thing you know, they just got, like, all this food, like, this multi-course meal just kept coming out, coming out, coming out, and I'm like, "Who is in charge? Like, who is ordering this
Right,
food? Where is this coming from?"
and it was
I
all
think
so
it was
delicious.
the plate and screw rep. At the end, I'm realizing, so thank you for sponsoring the dinner.
Yes.
But then it was like they're so excited to show us mariachi, and they had this little bird in a cage that they're like, "Oh, do you wanna do it?" And we're like, "I don't even know what it is." So they left, and then by the time they tried to call 'em over, it was gone. I think they, like, choose a fortune for you or
Oh, yeah,
something,
she
just
said
all
something
these
about opens up
fun
a
little
cookie or something for you.
yeah,
I
so
don't
all these
know.
funny little things, and then, for the birthdays, they have the
Oh,
luchadores, the Mexican wrestler masks, and they come and sing, and so next thing you know, they just got this giant wrestling ring shaped cake thing that they, like,
stand, yeah.
plop with fire,
Yeah,
like
just
firework
fireworks
fire
just spewing
spurting a
out.
sparkler spewing out, and, like, bring it right in front of Sarah. Next thing you know, they got Sarah
Oh my gosh.
spinning, and they got the luchadores all
Oh my gosh, I was mortified, because I'm not one to get up and dance, and then, I hear them coming along, and I'm like, "Oh, fun," they're bringing some more of that they're bringing some more desserts or somebody else is having a birthday, and then they pull
Yeah.
my chair backwards, and I was like, "Oh god, it's me, what am I gonna
Yeah,
do?"
it was your
You know?
birthday, who knew?
And so I, like, stand up, and I'm like, "Gosh," and he's like, you know, "Bailar, bailamos," I'm like, "Oh, no, me." Oh god, that was so funny. That was so
Oh,
funny.
well, and then it was getting close to the end, and Claudia was like, Are you guys tired? Should we go?" And then, one of the guys putting on the conference was like, "No, you have to wait." He kept saying, "Baile, baile, momento, Doctora Erin, you gotta baile." And I was like, "What?" And next thing you know, I'm, like, on a bench, everyone in the row, like, 6 people off the bench, and they're, like, pushing me out, and next thing you know, I'm, like, dancing cumbia with this guy,
And you were pretty good.
and they're all so excited. Yeah, and they're, like, acting like that was, like, the nicest thing they could possibly have done is, like, dance cumbia with me, and I'm kinda like, "They don't
Mhm.
know the Americans, most of us are pretty stuffy, and we don't feel like we know how to dance or wanna get in front of people and dance," but it was fun
That
and
was so fun.
very hospitable. And then I
Mm.
thought it was funny that it was like 1:30 in the morning, maybe 2, and it
Yes.
was finally like Claudia's like, "You guys are probably tired. Should we go?" And we're, like, trying not to be party poopers, but we're kinda like, "Yeah, we're old, tired moms."
Yeah.
So we both, I think, separately asked people sitting next to us, like, "Is it no is do you guys normally stay out this late?" And they're both, "Mm, yeah."
Okay.
Like, dinner we're, like, legit still eating dinner, it's, like, 1:30 AM, like, I could understand, like, hanging out at a bar, drinking, but we're, like, still eating, and they were all so sad that we left, and they were all, like, out for who knows how much longer, and this is on a Thursday night where there's a conference starting again at 8 AM. It's like, man, they know how to party.
Mhm.
We were definitely party poopers.
Yeah. Yes. That was shocking to me, you know, I think I was telling Spot about it, and he said, "Oh, well, I guess that's why they have a siesta in the day," and I was like, "Yes, we did not partake in a siesta." So
No,
I
unfortunately
so so
not.
I was not prepared.
We missed all the siestas for sure.
Mhm.
I know, I was like, "They really have, like, a hour and a half lunch, comida at, like, 2 PM or something?"
Yeah.
That's why.
Well, did it
Yeah.
make you feel better that other people ran over in their lectures?
I know, right? I was so worried about the timing, like, I knew I was gonna be short on some, and so if people didn't have questions, it was maybe gonna be too short, and so I think people were probably relieved that I got done in a timely fashion. No one seemed upset about that for sure,
Yeah.
for
Well,
sure.
what was your thought? Like, what was different about speaking there than speaking here?
Yeah, that's a good question.
I'll tell you my favorite part. Well, one of them was I didn't expect for them to do this, but when you were getting ready to give your first lecture, and I wish that I would have gotten it on video, but they had this man's voice that was like a beautiful, deep, luxurious Spanish voice, you know, that introduced you. And like, it was just so wonderful. I almost felt like you were going into the boxing ring, right? Like, here
I
comes
know, they have my picture, like, this
Tora
video.
Erin Sheffield.
I
You know?
know, I felt like the do 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 do
Yes.
do 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 do.
I
Yeah,
just
that
thought
was
that
like
was so cool.
and I'm, like, going, "I don't know what they're saying, I don't know when I'm" and Claudia's like, "You can go up now. You can go up now." I was, "Oh, it's time."
Funny.
I'm surprised I got kinda emotional seeing my face up there. It was, like, this moment of, like, "Whoa." Like, I was like, "Don't cry,
Mm,
Erin. You gotta go speak." It was kind of
that's
like
so
that
cool.
moment, feeling like, "Wow." Kind of that arrival moment. So that
Yeah.
part was really cool. And I was worried. I wasn't sure if there was gonna be an interpreter or not, and I didn't know how that was going to work. I thought when
Mhm.
it's a room of 5 or 600 people and everyone wants an interpreter, maybe they just stand up there and talk next to me, and I thought, "Oh, that's gonna be really distracting," but they just had headsets, and so I don't know, a lot of people didn't use interpreter, but
A lot of
kind of
people
was like,
did. I could hear the interpreter when
could
I
you
was in
hear
the
it
audience. I could
around
hear it
you?
in the yes, which I thought was really funny.
So I thought that was really helpful too, that I felt like, okay,
Mhm.
people are hopefully kinda picking up where I'm landing. But
Mhm.
I was nervous just about I wanted to be culturally sensitive. I wanted to make sure the slang I was saying was landing. I didn't wanna be making examples of things that maybe aren't applicable. And I did have a couple people come up and talk to me after. One of them said, like, "We don't use the same naming system you do, so when you say 24, that's a different tooth," which I don't remember saying 24, by the way. And
Yeah.
I knew that, and I was trying to use the international system or trying to say, like, 3rd molar, so I purposely tried not to, but maybe it's just habit by habit, I said, "our
Yeah,
system,"
that's a
but
hard habit to
also
break.
yeah. And then, the interpreter came up to me and said, "You really should tell people that you guys are so litigious, that you do things so much more conservatively because you're worried about getting sued, and you shouldn't we don't have to worry about that so much. So you should maybe give that context." But she kinda said it in a way, like, "And that's why you guys are doing coronectomy, but we don't have to do that here." And that's one of the big topics I spoke on, and I thought, well, that wasn't really the vibe I wasn't saying it, "Don't do it because 'cause you're getting sued." I'm not really worried about getting sued for that most of the time. I
Yeah.
go over my informed consent very well, but for me, it's more just sometimes that's a better option for the patient, but still, I thought that was interesting, but
Yeah.
yeah, it was fun. It was definitely a different vibe for sure.
Mhm. There was a ton of people in that room. Like, it was I would have, you know, I'm not even sure how I would have handled it. So, but you did great. It was really impressive, and you just rolled as if there were 5 people in the room or 500 people in the room, you know, I mean, it was
Oh,
incredible.
thank you. I thought I was gonna be really nervous, and I was worried my brain would shut down when I got
Yeah,
up
like mine
there
does,
because
yeah.
I feel very confident. I know I'm a good teacher. I can teach like, I teach Sunday school at church all the time, and even if I don't have the lesson prepared, I know I can, like, make a better than average lesson. So, like, I know I'm a good teacher. I'm pretty good off the cuff, but I was a little nervous I was gonna get in there and just kinda, "Ah," and
Mhm.
then it was mostly fine. No, a few little technical things where it's frustrating when you try to get your slides just so, and then, like, the pictures aren't coming up right, or some of
Right.
the fonts were a little messed up, or the videos wouldn't play, but overall, it was great. But in one of my lectures, and luckily it's a lecture I've given a few times before, although I revamped it, I had my notes, and for some reason, it wouldn't let me scroll to the bottom of my notes in the presenter view, and I kept trying, and it was just like, "Fine, like, I guess we're going." So,
Just going off the cuff. There it
I
goes.
just went off the cuff, and luckily, most of what I needed to say was written in front of me, so that was really, like, the only snafu, but I was surprised. I
Yeah.
just felt like once I got going, I felt at first I was kinda getting tripped over my words, but once I got going, I really didn't feel nervous. I felt really comfortable and good up there, and then
Mhm.
really relieved when I was done. But I don't know about you, usually when I speak or do something like that, I'm, like, feeling good in the moment, and then at the end, you're like, "Oh my gosh, did I say that wrong?" And do
Yeah.
you think everyone hated it? And I didn't
Mhm.
feel that way. I just felt really happy with how things went, so hopefully that was well-deserved feeling.
I know. I'm excited to hear some more of the feedback from Claudia once they get the surveys back. I think that'll be really interesting to read, you know? But I think what I really enjoyed was that you presented on topics that we typically don't see a lot in our meetings anymore, right?
Yeah.
Because they're seen as, you know, "Oh, yeah, we all do that. We all know how to do that, and that's fine.
Mhm.
I don't need to talk we
Yeah.
don't need to talk about that." But at the end of the day, what are all of us doing every day? Taking out teeth, right? And so I think it's pertinent, and I think that it is important to continue to lecture and talk more about that, write more articles about that, because just like you were saying, the research that we have is so inconclusive. From 0 to 50%, you're like, "Well, that doesn't help." How am I supposed to convey the risk to my patients when this is what you're giving me?
Yeah.
And
Oh, yeah.
so you can say, "Oh, well, in my hands," but that doesn't sound very evidence-based, right?
For
And
sure.
so I think that that was really well received.
Oh,
And
good.
then talking about trauma-informed care and talking about social media, I think you and I both were really surprised that there's a lot of older gentlemen in the audience, and they were the ones that were really pretty interested in it. They
I
were all
think you're
sitting
right.
forward in their seats and really
I was
engaged.
nervous as I started on those 2 topics. I was looking at how many older gentlemen were, and I was going, "This is the wrong crowd for this lecture." Like, "Oh, no, what did I do?" type of thing. And I don't know, at the end, I had quite a few of them come up to me. I was a little surprised how few people wanted to come talk to me. I had a lot of people ask for pictures, which I thought was interesting, and I think that was people were real nervous to talk to me, not speaking
Mhm.
English, but the ones who did were mostly elder gentlemen, and, some of them were even like, you said, the people that are hesitant, you talked about those people. I'm exactly that person, but I totally agree that you're right. We probably do need to be on social media. This is where patients are coming and all of that. And so, yeah, I'm going to have to give it a try. And so, I don't know. I felt like I won some of them over, which surprised me. And I
Mhm.
also talked about coronectomy, and I had this, he looked really old. This very elderly looking doctor came up to me and he thanked me and he said, I've never done cornectomy before, but after listening to your lecture, I'm going to start." And I was like, "Oh my gosh, that is like the best endorsement ever." Like, you
Mhm.
want to give a talk that actually is like changing behavior and updating people's practices and things. And that was not the demographic of person that I feel like normally receives me well. And to be that humble and excited to try something new, I thought was really cool. So I
Mhm.
appreciated that very much.
Yeah, that was really cool. That was really, really cool. I was surprised that as many questions as you got immediately after your lectures from the audience. They said they were asking for any questions as soon as you finished the lectures, and I was expecting that people had plenty of questions but didn't want to volunteer
Yeah.
just because of the language difference.
Yeah.
But there were assistants asking questions, and there were lots of different types of people asking questions, which I just thought was so cool.
Yeah.
I can't imagine at Amos an assistant piping up and asking a question in a room
Oh,
full of
sure.
oral surgeons.
Right.
I
Right.
just thought that was really amazing.
Well, and I was nervous pretty much about all of my topics because I was supposed to speak for 2 hours on third molars, and I'm like, "Why did I agree to this?" Speak to the experts, a room full of experts who do this all day, every day. What is gonna be new that I have to say? Or even if it is, are they gonna accept it with humility or just be like, "I know this already?"
Mhm.
And I know that I mean, I know I know surgeons, I know that that's probably the commentary, and so, I don't know, I feel like it went pretty well, and I feel like I was able
Mhm.
to find some hopefully helpful information and kinda summarize, this is what we're doing, or these are new things that may be worth thinking about, and here's what the research says or doesn't say, and then hitting on coronectomy again, which I think in the US, I don't know what your thought is, I think it's becoming much more common as an alternative to full removal, but I still think there's a lot of hesitancy or a lot of people that aren't doing it, but then I think international even more so. So I think it was hopefully an intriguing topic. But then the last lecture after you had left, we kind of were peeking in and we're like, oh, they're still going. And oh, this guy's talking about coronectomy. And I'm reading his slides, the Spanish, and trying to interpret in my head, and I'm like, "Oh my gosh, he is saying everything I've already said." And I was feeling kind of like, "Oh, no." And then these guys behind me were so nice, they're like, "Don't worry, he's saying you're right, he's saying everything you said already, and even said Dr. Sheffield already said so well before."
Oh, wow.
So I was like, "Oh, so he's not proving me wrong?" They're like, "No, he's just reaffirming what you said," and then we are kinda joking, like, "Well, hopefully I said it better the first time."
That's such a great validation, right?
But it was really kind that I bet they were wondering, "Oh, no, she's probably thinking, 'Oh, no.'" But I was glad, it's good to hear
Mhm.
sometimes you need that repetition to remember
Mhm.
or to just get that confidence that it's not just some weird American lady saying to do this thing that, like, this is actually supported in the research.
Right.
He took much more, like, academic spin, putting up the articles and stuff, but I appreciated that they seemed happy to receive it again.
Mhm. Yeah. What else do you think was surprising to you about, let's say about the conference itself, about oh, the academic part?
I don't know. What was there anything that was surprising to you that we haven't talked on?
I thought with all of the topics that we have in oral surgery, I thought it was really interesting that many of the topics were repeated.
Oh, yeah. I think they were trying to stick to a certain theme maybe,
Mhm.
but yeah, they definitely hit on, like, the surgical or even I was talking on my Instagram, I was trying to decide if I wanted to include a case that I was kind of embarrassed about where, like, early in my career, I lost a tooth into the infratemporal space, and there's a lot of people that are like, "That should never happen if you're doing things right," and, like, well, it happened to me, and
Right.
I'm
And you're
embarrassed
obviously
that it
not
happened,
alone.
I wish it hadn't happened, but
Mhm.
I was like, "Well, I feel like there's some good things we can learn from this," and so I decided to present it, and then the day before, some guy was talking about it and showed,
Yeah.
like, multiple cases, so I was like, "Alright, it's not just me."
Yeah.
So, thank
Yeah.
you for that.
Yeah. That was
Thank you
good.
for that.
One thing that I thought was interesting was the vendors and their booths and stuff. There were I just assumed because at Amos, it's the whole expo center is
Yeah,
filled with vendors,
sure.
and here it was a small little area. Most of them just had surgical instruments,
Yeah.
and there was like one little booth that had textbooks and what else? There was like a drug manufacturer or provider that had samples of amoxicillin and clindamycin,
Mm,
and I thought that was so interesting that
so
they're just
much
handing out
chlorhexidine.
yes, we
In
so
all
much
its
chlorhexidine.
forms, the
Yes.
gel and the spray. I mean, so it was kinda cool. I'm like,
Mhm.
"Oh, can we" they're, like, giving it to us, and then we're like, "Thanks," and they're like, "Oh, no, you can't have that." "Oh, I can't? Oh,
Aw,
okay." But
man.
that's what I wanted. I wanted the spray.
Yeah. Yes, but
Yeah.
I'm working on my ability to talk with vendors, and so this was another step in the right direction. 'cause
That
I
was
just get
kinda nice. I get freaked out going in the vendor hall a lot, like, I'm
mhm,
trying to change my mindset, especially as I'm going in more as like, "Hey, would you sponsor my event?" But
right,
so I'm trying to get used to it, but I hate the, like, "Hey, come on over," and so at least the Spanish part, I'd just be like, "No sé,
right, yeah.
mm,
"No comprende." Yeah,
inglés,
yeah.
todo inglés." Yeah, so it's funny.
But it was fun because there was a couple of people that were very proficient. Most people could speak some English, but there was a couple people that were very proficient in English, and so the other vendors would go and grab them and bring them over and ask, clarification of what I was asking,
Oh,
which I just thought was really
man.
funny.
Yeah, that was funny, and they were so gracious. The Churritos, the boxer, we noticed, like, "Oh, he has this skull hat, and it's from one of the plate vendor again." And
Traumatic.
we said, like, I want that hat." And then we saw his shirt, and we had this, like, soccer style jersey, and we're like, "It's got plates and screws on it too. I want the
That was so
shirt." And
cool.
we, like, said something, next thing you know, they're like, "Here's your hat, here's your shirt." And we're like, "Whoa, thanks.
Whoa!
Ask and you shall receive." And
Yeah.
then you even got some free instruments from one of the
Mhm.
vendors, like,
Yeah,
I
I
don't know
did,
how I
because I
missed
was
out
talking
on
about
that.
sterilization cassettes, and then he hands it to me and says, "This is for you," and puts it in a bag, and I was like, "Oh gosh, okay, wow."
I
And then
know,
he says and then he gives me a periosteal elevator and then this, like a
I'm
spade. I was
sorry
like,
I was
"Wow."
not with you at that moment
I
because it would've
know,
been rude
right?
to give it to you and not to me.
See? I know.
See.
Mhm. See, 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 see. I
Oh,
see what you did there.
man.
Yeah.
Yes. See? I see, I see. So, what was it like as the friend in the audience watching me up there? Were you nervous for me? Like, you know,
Yeah.
what was the vibe?
I think I was a little bit. I think that I sort of stood out. People knew that I wasn't
Yeah.
from there. So, I was taking a bunch of pictures and I was walking around and that sort of thing. And I think at first people thought I was your assistant or your social media person or something like that. I was like, oh no, I'm an oral surgeon. And they're like, oh, wow, okay. And that was kind of funny. But I think that you weren't giving off nervous vibes. And so I think
You were able to relax.
that calmed me down. Yeah. Like, "Really, Sarah?" But that calmed me down so that I wasn't like, but I thought it was really fun just to take it all in. It was so low pressure, really,
And I would
from my
look out and
standpoint.
see you smiling at me, and then sometimes I'd be like, "I hope she thinks I'm doing okay. I hope she's smiling because she's not bored," or, like, in some ways, it was nice to see a friendly face, but it was also kinda like, "Oh, I hope." This could be embarrassing if I was, like, blowing it in front of my
Yeah.
bestie, you
But
know?
as you know, my facial expressions give away exactly what I'm thinking,
Then you're
you know.
smiling, and that was good.
See? Yep.
And
All is well.
could you tell so at one point, I thought there was a vacuum outside the conference room. It was so loud, just as like,
That was
and I
so
was
funny and
like,
so unexpected.
"Oh."
Yeah.
'Cause I'm like, I'm all for getting the images, but it was just funny because it was so loud and so disruptive that I'm surprised that they're like, "Yeah, just go for it.
Yeah, there was a couple
Send
times
out
that
the."
I thought there was I knew exactly what it was as soon as I heard it, right? And I don't know why, I guess. But there was a couple times because they had the little camera on a stick too, and my favorite was when they come around you and they, are moving it all
I don't think I
around, and I'm
noticed
like
most of the time, but
I
there was
was
one
like, "I
time I was
wonder
like,
if that's distracting." You
"Oh."
just kept talking, and I was like, "How is she not distracted by this?" I'm like I would have been like, What are you doing
Oh,
back
and
there,
then
guy?"
after my first talk, it was supposed to be, like I thought it was originally supposed to be 2 hours. I thought that they had me on the schedule for 90 minutes, and they had this clock, but I couldn't really see it, and at one point, I kinda saw it, but then at the end, they're like, "Could you see the clock? Could you? Could you see it?" And I was like, "Did I no?" And did I go, like, way over something? Like, was I really wrong? And they're like I think they just want so they made sure they moved it the next time, so I think they were
Yeah.
just, like, trying to make sure. But then the next time, it seemed almost like they had, like, my cumulative time that I still had, like, 3 hours to go, and
Oh,
then so my second to last lecture said 25 minutes, and I'm going, "Am I, like, way over?" And people are like, "Oh, no, she just keeps talking." But then luckily it restarted, and I was like, "Oh, oh, phew."
Yeah, I could tell in the first lecture that that was like I could feel this little buzz kind of happening, right? Because it was right before lunch, and I could feel this buzz, and I knew that your time was getting close. But since the guy behind you finished late, so you
And we
started a little bit
started
late.
so late, so I had no
Yeah, and
idea,
so
like,
I had no idea either, but I could feel the palpable buzz in the
they're
room,
like, "It's
and
siesta time. It's time." Well, and then we went to lunch, but I was like, "I don't have any idea what time we're supposed to get back."
right.
Claudia, what she's like, "Oh, we have an hour," and we, like, go to this busy restaurant, and I'm like, "I just really don't wanna
I
be late
know.
to my own talk."
And they got us in so fast, and our food came so
Oh my
fast, and
gosh,
it
it came
was
in, like, 3
so
minutes. Oh my
delicious.
gosh, so amazing.
I just wanna eat all of it again and again and again. It was so
It
good.
was so amazing.
And again,
And
I
they had
can't
these
understand
coat
that.
rack things, like
Oh,
these purse
yeah.
racks that were at the table that were, like, head seated height, and I was like, "Man, why don't we do this? Put my purse and my coat right there.
Right. I know.
Fabulous."
We got a lot to learn. Mariachi bands, canaries, coat racks,
Well, I didn't tell
you
you
know?
this, did I? She dropped me off at the airport, and I went to get checked in, and all of a sudden I'm like, "Where's my purse?" And I'd left my purse in her car with my
Oh,
passport and all my money and everything, and I was like, "Oh, no." The
oh,
number of times I've
dear.
left that specific purse, like, I'm so bad about it, but luckily she answered the phone right away, and by the time I made it after snaking my way all the way back through the airport, she was right there, and can you imagine she wasn't answering her calls or
Oh my goodness. No. Ugh.
so,
Yeah, I
phew,
got to
I
the
made
airport
it.
and I thought, I feel like I'm here a little bit early, but I don't know. And so I go to try and check in. And then since I was flying standby, I had to go to this other little place and so that I could check my bag there. And then I had plenty of time, but tried to go to the little priority pass lounge and there was a wait list. And so as I was waiting around, then my gate finally popped up and because they don't assign the gate for an hour and a half or something before. And I was like, "What is R4?" And I had no idea how to get to this gate. I was over by, like, the 75 gates, and I had no idea how to get there, and I was trying to search online, I asked
It was
ChatGPT a couple
confusing.
times, and so I was like, "Well, I guess I just need to go and look for it." And so I walk over and I finally find it, and it wasn't very far from where I was, but it was this remote gate, and so it says, "Be there
Mm.
on time," and and I'm like, "Well, what is on time?" Because they said boarding at 7:15, but now it says boarding at 6:55. So I'm like, "Oh my gosh," and so I didn't even get a chance to eat,
Oh, no.
and I was like but then I was there and waiting because I was waiting for my ticket, and then I didn't want to not be at this R4 if they decided, "Okay, well, now's the time, and we're all leaving," and then I'm just left behind, and I'm like,
Right,
"Oh my gosh," because it's not like walking up to a gate with a gate agent, you know?
right.
That was really
When I
stressful, and
had lounge go ahead.
I was asking in the lounge, I asked a couple of people if they knew what R4 was, and nobody really spoke any English, and I was like,
Right.
"This is
Well, I
gonna
had
go
lounge
well."
access because I was flying first class, but I didn't realize it until after I'd passed it, and then I was like, "Should I go back?" And then it ended up being a really, really long walk, so I was glad I
Oh,
didn't go back. We're just like, "Man,
yeah.
yeah, this is a big airport," and I don't
Mhm.
read Espanol great, but yes, I did enjoy the lounge in Houston, but then I was flying first class, my first time ever flying first class, and I put my phone in the little, like, cubby. They've got, like, bigger cubbies in first class to, like, put your things, and when I pulled it out, someone had put their chewed up
So
gum
gross.
and got right on my phone case, and I was so annoyed. I
So
was like,
gross.
"Well, I guess just 'cause you fly first class doesn't mean you have first class manners." Like,
Yeah, it doesn't make you classy.
gross!
Stay
I'm
classy
trying to
first
get it
class.
off, like, oh,
Yeah.
so gross. Yuck.
So with the people, the one thing that I was really surprised about with the surgeons, and we've talked about this extensively, I thought it was really impressive how most of them still continue to practice full scope. And so what it sounded like to me was that they usually have their own private practice. And then they are also sort of have a group that they work with, just an agreement. And those surgeons have their own offices. And
Oh,
then most of the time in their private practices, they're doing wisdom teeth and implants, and then but they're not allowed to do their own anesthesia, so they have to hire someone to come and provide anesthesia. But if they're doing bigger cases, they'll join with one of these other people in their collective that they've made to go to the
Mm,
OR with.
okay.
One gal I was talking to liked to do cosmetic procedures, and so she would do blepharoplasties and, uh, buccal fat pad removal in her office or at the hospital just based on, what the patient wanted, and there were others that were doing orthodontic surgery but most of them still practice full scope, and I thought that was really, really interesting because it's kinda difficult here to do that.
Yeah,
And so because you're either in or you're out, you're either part of
right,
the hospital crowd or you're not. And it
right.
seems that even like I would love to go and do those cases, but it just becomes kind of difficult to do.
Yeah. Well, and I think it's interesting too. I was talking to a couple of probably 3 or 4 doctors towards the end of the conference, and we were talking about just how different it is in the US versus, there, and they were saying, "Yeah, it's maybe like 100 something dollars to get a impacted wisdom tooth out here." And I was like, "Well, yeah, it's easily, like, close to 500 here." I said, "It's probably, like, 2,500 on average in my office for, like, all 4 with sedation for 30 minutes," and they're like, "Whoa, that's a
Mhm.
lot." But then they're also talking about how much did dental school cost, and they're
Right.
like, "Oh, it was $2,000 maybe." And one of them, like, was like, "I think it was $40 for me," or something, so it's just like,
Wow.
"Whoa," so people are always like, "It's such a scam in the US, go to
Mhm.
Mexico," and yeah, it's just different, and
It's just different. Yeah, it's
yeah.
just different. But I thought that was really very interesting. Just such kind people, such wonderful, kind people, such delicious food. And the
Oh, I
city
can't believe
itself, I
how good
think
the food.
everybody here is really concerned because the news really makes it sound dangerous and,
Yeah.
don't go there, you'll get abducted and you'll be
I felt
trafficked
much
and
safer than I have in Cancun or Cozumel,
Mhm.
etcetera. It felt a lot safer to me, so the tourist places where
Same.
people go, I feel like are maybe less safe.
Yeah.
I could
Well,
be
but
wrong,
I feel like they
but
always
it felt
have
very
been.
safe.
I remember in
Right.
college going down there and you go to the airport, you take a bus to the resort,
And we
and
don't
you
leave.
don't leave.
Right.
Because they say, "Don't
We
leave because it's
right.
dangerous."
We walked
And
all
s
around.
We sure did, and it was beautiful. The architecture was beautiful, the
And the
people were so
tacos,
kind.
like,
Tacos.
I'm still kind of mad/puzzled, like, why don't the tacos taste like that here? Like, I have Mexican people making the tacos a lot of the time, but
Mhm.
it's not the same as they were there. It's just
Mm-mm.
it's not the same at all, and there was one taco that we were asking
Mhm.
Claudia, I was like, "Oh my gosh, this is my favorite one. What is this?" And she just kept saying she was like, "It's a tortilla with meat and cheese," and I'm like, "But what is it?" "It's a
Right.
tortilla
What's
with
the
meat and cheese,"
meat?
and I'm like, "No, it's not. It's not.
Yes, it's
What
not
is
just
it?
that. No, it's so
What is
much
this?
more than
How
that.
can I order this ever again in my life?"
Yeah.
And then the last day we went to the, like, ending fiesta, like,
Oh,
and,
yeah.
we were waiting, we were there for, like, 2 hours, and I guess there was drama in their business meeting before, and so they're, like, arguing about stuff, and so it was, like, 9:30 PM, and we're still waiting for this buffet that's just sitting there, and finally, she's like, "Do you wanna just go get tacos?" And I was like, "Of course." So we walked across the street to this Michelin star taco place, and it's just this, like, very casual
Mhm.
walk-up taco type place, but it was great, but it wasn't any better than any other tacos that I'd eaten the whole time,
Right.
so, yeah, it was fun.
That was so cool. She was just the most gracious of
Oh
hostesses.
my gosh.
Unbelievable, unbelievable. I
Unbelievable.
can't wait to go
I
back.
know.
I just think it's such
I
beautiful people.
Me too. We'll go back.
Yeah,
Let's go.
I know.
Alright.
We got a lot more, things. We didn't get to go to, Lucha Libre? Is that what it's called?
Oh, yeah. We
Lucha
were gonna go to the
Libre?
wrestling match,
Right.
but we went to the boxing instead.
Yep, which was pretty epic. So what's next on
Definitely.
your international speaking engagement journey?
I don't know, I'm ready for anyone who wants to book me.
It was
We'll
pretty
see.
fun. I think our friend Stephanie said she loves international meetings, and so now I understand why.
Yeah, I'd be curious to go as an attendee,
Mhm.
especially if they're speaking English.
Yes. Yeah.
Definitely.
I just thought it was great.
All right, any last minute takeaways?
No, thank you for taking me. That
Thank you
was
for
really
coming.
wonderful. Yes,
It was so
anytime.
fun.
It was so fun.
All right, hasta luego.
Hasta luego. Signing off, Doctora Sarah Harding.
Yeah, we were talking about that. And Dr. Erin Sheffield. Thanks again for hanging out with us on another episode of the Resting Stitch Face podcast.
If all of this resonated with you, or if you found these conversations interesting, or a friend that would find them interesting, please like, share, follow along, and we'd love to have more conversations with you soon.
Catch you next time.